Well, welcome everyone. I thought it was time for us to do another update on the COVID situation, COVID-19, both in America and the world, because we're tightly interrelated in every way. And one of the most important things that I think for us to understand is that while the situation is extremely good in Madison, Wisconsin right now, and we'll talk about that, it is not really so good worldwide. That's very important. And A, we take care of the rest of the world, and B, we not let mistakes made elsewhere be repeated here. There's very happy news. I mean, we live in a state that is down to 73 cases per day on the average day, 84 hospitalized, 26 ICU patients on any given day in this state, and only 2 deaths per day, which is massively better than it was during the winter and the fall. And this is entirely due to vaccines. There is a ebb and flow of what you see from the standpoint of um, COVID infections worldwide, which is really inexplicable. Doesn't seem to be related to weather or latitude, but it does relate to exposure of people who are unvaccinated to the virus and its variations. We live in the highest vaccinated county in the United States, but the rate of vaccinations have stalled. In any state, it might be anywhere, or any region of the country, it might be between 30 and 70% are vaccinated. And as that has fallen, there's several reasons. One, people don't like shots. Two, there's political beliefs around this, some of which are relatively bizarre. And three, just complacency. People think that this problem is over. Well, it's not really over, and I think the rest of the world shows us what's going on. In many parts of the world, there is 3% of the people vaccinated, and of course, some there's almost zero. Israel may be similar to the US, some of the European countries, but most are not. And those countries were really just lucky or underreporting. We know that countries like North Korea that claim they had none are now um, taking vengeance against administrators because they admit that they do have COVID. And you see how India was devastated, Brazil now, and other countries similar. The concerns are high. We're not traveling yet. I know only 10% of study abroad programs are open, and it's very difficult to travel country to country. Australia is locked down again for the umpteenth time. And this isn't going to end really until either good fortune causes this virus to go away, which it will go by its own pace, or vaccinations. And understand the pace of viruses going away has been sometimes remarkable, like as in SARS and MERS, but other things like in plague have been with us for approximately 1,000 years. And it doesn't go away easy. The problem with the people who don't really believe that this is a real thing is real in other parts of this country. We actually have physicians who are accosted by families and patients who are admitted for COVID-19 pneumonia, and they claim they can't possibly have that because they were told it didn't even exist. And it becomes quite adversarial and dangerous in hospitals in other parts of the country. Nevertheless, because of the decrease in numbers in the US and the increase in vaccines relative to the rest of the world, we're starting to open up. Believe me, it's a wonderful feeling to open up, but we have to do it carefully. So what do we know? What have we learned about this? Well, a lot of the lessons we've talked about for the past year are still true or magnified. We know a couple things. It's a very contagious disease. As viruses go, it's not anywhere near as contagious as, say, measles, but it's quite contagious. It has a case fatality rate over the course of last year and a half of 4.4%. It will be lower as more young people unvaccinated get this disease and more old people are vaccinated, because the young people tend to survive it better although they may have long-term consequences. Compared to SARS in 2002, that had a 9.5% case fatality, or MERS in 2012, a 35% case fatality. Fortunately, MERS, a different type of coronavirus, was not as easily transmittable, and it seemed to have gone away. Just as some things rise and fall inexplicably, like Zika, COVID is much more in for the long haul. Now remember, this is the same class of viruses that gives us about a third of the common cold, some gastroenteritis, and so finding strategies to treat this has been important. One of the reasons case fatalities are down in this country is we are better at treating it, but it does require some relatively sophisticated ICU type care and better oxygen and cytokine storm treatment. That's not always available in other countries. India quickly outran its supplies when enough people got sick and people died simply for lack of oxygen. That could come in this country as well if we overwhelm even our very robust healthcare system, and especially our less robust healthcare system in rural areas. Now, there's a lot of talk about the mutants or the variants, and that is important. Right now, the talk is about the Delta variant. Now, what has happened over the past year is we've learned about the virus. We first thought it didn't aerosol much. Well, it does. It's obvious. If it spreads so easily in indoor spaces, that's aerosolization in the closed area. And open ventilation and outdoor events, much, much safer. We know that the masks are different. They're very effective. We've learned a couple things. The clear plastic face shields aren't very effective against this disease. They are good for not being splattered, chemicals, or intubation, saliva. But as far as a shield, it's not that effective because this thing will just waft around the plastic shield. It's the masks that cover nose and mouth that are effective. We've learned that paper is more effective than cloth because it's not really the thickness. There's a certain static electricity sort of charge between the paper fibers, which seems to entrap the virus to some better degree. Hence, the surgical masks are probably better than the cloth masks, and the N95 version of a surgical mask the best. That made sense. We also learned that it's probably more seasonal than we thought. Even though you can have it in Australia and England at the same time, if you look at the US, it's clearly was seasonal and may be again this fall. So it would be ideal to get vaccinations on board before that happens. Now, the vaccinations we've learned, the various types that I talked about at other times, are very different. Your average vaccination, flu, etc., isn't that effective. And we were dealing with 40% effective, 60% effective. So when some of the COVID virus vaccines came out at 60% effective, that seemed regular business. And this is what you see in some of the vaccines that were developed in other countries. But the RNA type vaccines made by Pfizer and Moderna have been remarkably more effective, and they remain effective to the mutant variants. The Delta variant, which is now becoming dominant in the world and will become dominant in the United States within 6 weeks. It's already present. It's already transmitting rapidly. It's very easy to transmit, and it makes you sicker than the variant that was here last fall. It still is stopped by the RNA vaccines, not so well by some of the other vaccines from India, Russia, etc., and China. So it's even more important to vaccinate and to vaccinate the entire world, because the entire world will, A, need it, and that's what we do as humanitarians, and B, they will grow mutants that will eventually outwit our vaccines until we spend the 4 to 6 months to develop a new vaccine to that variant. Thus far, though, the ones we have are still effective. So It is a good news in that regard, but not a time to let down your guard. Because the Delta variant is back, there's great confusion over do you wear masks, do you not wear masks? The country is opening up. Believe me, if you leave Dane County, there's a lot of people that don't believe this even exists. Masks are frowned upon, um, but it's clear that they are safer for even vaccinated people. It's probable that they're not necessary when vaccinated people mean vaccinated people outdoors. And I think that that's true. And we even held a picnic recently for the department outdoors for graduation, which was a great success. And I think it was very safe in that setting. It is a recommendation of some medical physicians, though, that you still use a mask in crowded indoor places. And certainly common sense protect yourself. There's no way you should get on an airplane with its very closed, recirculated air without protecting yourself. Same with buses, trains, etc., even though you're vaccinated. And that's mainly a concern about these variants chipping away at the efficacy of your vaccine. It's unknown, and that's why protect yourself makes sense. However, we're opening up very much so. We're at a university that wants to open up, and indeed the strategies, we're all waiting to see how they'll go. We can make some predictions. The university badly wants students in their seats, in class, and in the football stadium in the fall. And that's clear. It's an admirable goal. It would be wise if everyone was vaccinated, and it'd be wise if you're an indoor and crowded together, you wear a mask. I think that's just plain common sense. It is likely that we will be more and more working in the buildings, in the offices. And I'm very much interested in how this turns out because it's hard to predict. Certain employers are saying, give me a reason why you should be in the office. Other employers are saying, give me a reason why you should be home. And I think there's truth in both. I do think what I've always predicted that it's going to be about 60-40 as far as people in office and people working remotely. And actually, depending on what type of work you're in, it could be 40-60 or 60-40. But I think that combination, in other words, the online things have gotten out to more people. That's effective, but doesn't necessarily mean that it's better. Certainly not very good for me sitting in a chair, I guarantee you that. However, I think that the university is clearly working toward a strategy of more people in the offices than home because we are now drawing up um, preliminary plans to how we will justify to the office at the university university employees who needs to be at home. And so that is my reading that they will take that stance. And I think that a large number of people will work effectively from home and the extra space will be useful, etc. But it will need to justify it. I do think that things are going well, but if we really are realists and we have a surge of a new variant and half the country on average is not vaccinated, we'll have a lot of sick people. Fortunately, the first waves of vaccination in this country were the very susceptible elderly. They'll be protected. However, we know, I just wrote the grant on long haul complications of COVID, that this is a very real threat to the young people. So as predicted, the vaccination ages are dropping and dropping as people are testing more and more children to see what's safe, and they must do that to be safe. But I predict we will be vaccinating and re-pushing for vaccinations. I fear that a fall surge will catch off guard people that have completely left their guard down. So I recommend you don't. And if you can do anything, I recommend you spread the word that, and outside of Dane County, that vaccinations make sense. They protect you, they protect each other, and they protect the future from the variants. So Looking at it on balance, lots is happening. It's been totally predictable. The thing that no one could predict would be that the US vaccines would be so effective. Nobody predicted rates up in the 90s of efficacy. And that means you still have some risk if you're vaccinated, but it's remarkably small. So the word is to get the vaccinations, be cautious, do open up a bit, but don't be silly. And I'm not really recommending international travel until we see greater control worldwide. So that's what I have for today. I hope it's a hopeful message because I think we all need to do more and more normal. Just do it a little carefully. So I'm proud of you all. Thanks for everything. And as always, I'll pause a bit and answer any questions you might have, or you can simply email me. I'll be happy to answer them.